My name is Paula Lovelace. I'm the office manager at Yellow House Dental and Implant Center. I've worked in the office for about 30 years, and many of those years I have dealt with insurance questions. So I'm going to do some topics related to insurance. Today we're going to talk about preferred provider organizations, or PPOs. One of the most common questions we're asked on the first call when people call in is, are you in my network? So I want to give you an idea of what that means and how that applies in our office. An in-network office or dentist is contracted with the insurance. They have dictated fee limits for their services. An out-of-network provider has no contract and they can balance bill. That means if there is a difference in what the contract amount is, you can bill the patient for that remaining balance. Most of these policies that we deal with will have a limit of $1,000 to $1,500 commonly, and for both in-network, out-of-network, for the most part they're the same. Rarely do I see any differences in those. We made decisions years ago in our practice that we would not participate with any insurance contracts. Our doctors are very strong in believing that the relationship between a patient and a dentist is the best way for a patient to make decisions about their dental treatment and what they're going to do, and that the interference of a third party or insurance is not always in the best interest of that patient. So they have chosen to keep that relationship very pure between the patient and the dentist. An example of interference would be when an insurance company would only cover the least costly treatment option for a patient, compelling them to choose something that might not be in their best interest long term. One of the things to keep in mind is that dental insurance and medical insurance are very, very different, so don't make the mistake of trying to compare those. The numbers are much bigger in medical. If you get out of your network in medical, that can really be very detrimental. In dental, we're talking about a small number, so it's usually not that detrimental to a patient. This is one of many topics for insurance. We're going to keep them short and sweet, so we look forward to our next conversation about insurance. Thank you.